My focus is early intervention. I really love working with young children, and I do speech assessments for young children. It's kind of my specialty. And so I know I see many parents that are concerned or not concerned. So the reasons you should seek an evaluation would be, one, a red flag would be loss of words. So that's one of the big things, is if a parent says to me, my child has lost some words that he used to say, that's not typical language development, and it's definitely a reason to push forward with an evaluation. So any words they used to say, they're not saying anymore, that's important to get an evaluation. Lack of words, so not enough words. So by age, I would say 12 months, you should be having at least, 1 to 5 words. It could be mama, baba, dada. By 18 months, the child should definitely have what's average would be about 20 words. So I would say to seek an evaluation if you have no words to about 5 to 6 words would be appropriate to look into an evaluation. By age 2 years old, or 18 months to 2 years old, the child's really lots of words coming in. I would say 50 or more words by 18 months, and starting to put 2 words together. So again, if you have 5 or 10 or no words, it's definitely a reason to follow up on a speech evaluation. And then by 3 years of age, I always say it's about 1 word per year. So the child should be saying 3 words together, about many hundreds of words, including verbs, eating, sleeping, let's go to the park, things like that. Mama, come here, things like that. So there's a concern of mine would be a child who labels things. So they're great at blue and red and purple and number 5 and number 10, letter A and Z, but they can't tell you that they're hungry, or they can't tell you, yeah, let's do that again, like more. Or they can't say, help. So those communication words aren't there. That would be another reason to pursue an assessment. Speech pathologists don't just work on expressive language, so how many words children say. They also work on what we call receptive language. And receptive language is how a child responds to their name. So when you call Joey, does your child immediately look to when they hear their name, or are they so focused on what they're playing with that they don't look, and it takes multiple times for you to call them? That's another concern for speech and language. Or say if you say a simple direction like, can I have one? Give me one, give me. I always say try to offer your hand and then say give me, and the child hands it to you. But if you only say give me, and they don't hand it to you, it's probably that they're relying on this to understand what you're trying to say. And so that would be a child that maybe they're not understanding quite that many directions that they should for their age. Yes and no questions. Do you want a cookie? And the child doesn't respond. They go, and so yeah, that means yes, but they're not doing this or this to indicate no. That would be another reason to follow up on an evaluation. And these are areas of receptive language, so how a child understands verbal directions and verbal questions. And then the last area that we kind of, or not the last, but one of the areas that we look at is called pragmatic language. And that's a little bit more difficult, and it doesn't really have to do with talking. It has more to do with nonverbal communication. So when a child needs something from you, do they look at you to get your attention? So it's like, how much are they focusing on your face? Can they look at you when they need your help? Do they tap you if they can't say the word? Do they allow you to play with them? So if they're playing with their trains and they need their trains a certain way, then they're not really allowing you to play with them. These are all concerns for the social language, and possibly a reason to look into looking for an evaluation if you have concerns with eye gaze, like they're not looking enough at your eyes, or they prefer to play by themselves and they don't like you to play with them. Taking turns, or they keep walking away from you, they're not really interested. So those are areas of social skills or pragmatic language skills. Before age 3, we're not super concerned with speech sounds, except for the fact that if a child's really having a hard time coordinating to make certain sounds, then it's something that a speech pathologist can detect. But if they're saying, you know, like say for instance, cool for school, these are things that could be okay to not pronounce correctly, and they're still developing speech sounds, but only a speech pathologist could really tell you if this is like developmentally okay, or whether the child really does need speech services because they might have difficulty coordinating their mouth to make sounds altogether. So that's kind of what we do as speech pathologists. So many times parents will say, why should I move forward with an evaluation? Maybe he's just, you know, a little bit slower to get the words and he's going to be just fine. Or, you know, I was a little speech delayed when I was younger and I talk just fine now, so I don't think it's really that important. So yeah, I mean, I always say to a parent, you have, you know, all the reason to not be super concerned. And but it is my job as an early intervention speech pathologist to mention what the reasons why you should pursue speech therapy assessments or speech therapy if your child's found to have speech needs. The reason is no one can really predict the future. So if your child has a speech delay, we can't tell who will outgrow it on their own and who might not outgrow it on their own. So then the child turns 3 and it's preschool time and they haven't outgrown it. And now it's time for the child to start socializing with other children and be in a preschool setting, you know. And so we don't want those delays to impact their social environment once they get to preschool. We want the child to be able to say potty, because they're potty trained, they have to go to the bathroom. We want them to say mine when someone takes a toy from them and they're outside playing. We want the child to defend themselves against other children by using the words and not being physically, you know, pushing when someone tries to take a toy. We want them to say no when they don't feel comfortable, they don't want something, that they can say, no, I don't want it, or I don't like it. And so there is a lot of language that needs to be in place prior to that preschool experience so that it's successful and the child feels you know, happy and content and just there to engage and have a good time and learn. So without those words, without being able to follow directions, you know, without responding to your name really well, you know, in the classroom setting when there's 15 to 20 other children in the class and there's noise in the background and the teacher says, Joey, if he's not following you, when, you know, the parent, when you call him, he's really not gonna, you know, not gonna know how to respond to a teacher's calling him, especially with all the background noise. So I think that that's one of the key reasons why it's important to look ahead. Not just right now, like, oh, I think he'll be fine. Yes, the chances are he could be fine, but what if he's not fine? Speech therapy is actually a really great, fun way of having your first kind of facilitator, helper, support, you know, making it fun and motivating prior to that preschool experience. So that would be one of the reasons I always tell parents to consider. We don't know if it will, you know, if they will improve on their own, but do you want to take that chance? So that's one of the reasons I would say it's really important to follow through. If you're seeking an evaluation for a child under 3 years old, these would be your options. So you can always get a referral from your pediatrician if your insurance carries speech therapy and they do evaluations, so you can always seek one there. Sometimes, the drawbacks to that would be that there are wait lists sometimes, and also that the pediatrician might be reluctant to send a referral right away. So then your other option would be contacting your local regional center. Every county has a regional center, and they should be able to provide a free speech and language evaluation if you call them and refer yourself. Then there are also another way would be just to contact or look up on Google like resources in your community, speech therapy resources, and a parent can always pay privately if they want to know more immediately whether their child needs speech support or not. And so yeah, those would be the 3 ways to kind of look for speech therapy under age 3. So through your health insurance with a pediatrician's referral, through your local regional center in the county, referring yourself, and then private speech and language therapy evaluations. So that's prior to age 3. If your child's over age 3, you could still also continue to go with your insurance provider, if they can tell you where if they're contracted with a speech pathologist agency. The second way would be contacting your local school district or public local school district. So whatever city you live in, you can look up what the county office is and look under the special education department. They provide speech pathology evaluations, speech assessments for free also, but there's also a very long process. It's a longer process. And then again, privately. So these are the options after age 3.